Hello and welcome to our special session on the occasion of World Food Safety Day celebrated on 7th June as declared by the World Health Organization and International Men's Health Week starting from June 10 to June 16th as declared by the United Nations. Today we have a renowned gastroenterologist with us today, Dr. Yogesh P. Harwarni. Dr. Harwarni holds an MBBS from NIMS Hyderabad and a fellowship in advanced endoscopy from Japan. In addition to his impressive medical career, Dr. Harwarni has a strong commitment to community, having participated in various health campaigns and earthquake relief efforts. With extensive experience in both clinical practice and advanced endoscopic procedures, Dr. Harwarni has worked at some of the most prestigious institutions. So today we will be discussing some crucial aspects of gastroenterology and its impact on food safety and what that has on men's health. So doctor, let's start a little bit with food safety and why is it important in relevance to the consumers, the people who eat the food?
So basically tomorrow is a food safety day. So the concept of food safety day is to make aware consumers what actually they should eat, what kind of food they should eat, how it should be prepared, how it should be stored, and within how much hours it should be consumed.
Right.
So that the food doesn't get infected by various microorganisms which may lead to severe foodborne disease like acute gastroenteritis, cholera or even typhoid, which may sometimes lead to critical illness also. So the idea of food safety day is to get awareness, but we know that this cannot happen in one day, but at least it can be a beginning for the consumers to get aware of that.
Right.
So our suggestion is that in today's hectic life and busy schedules, usually what happens that people keep on doing work and keep on eating. So they don't realize what exactly they are eating, and most of the times earlier it was in West, but now we have in India also that most of the foods are processed foods, So even with this scenario in today's that husband wife both are working, so usually food is also prepared early in the morning, or it is yesterday's food and then recooked. And sometimes even both of them nobody cooks at home, so they depend on the mess or food from outside or from Zomato or Swiggy. So sometimes all these things is very okay, but daily if we keep on doing, then most of the time if we are consuming processed food, so now there are various studies which also show that the more processed food, like the food which have preservatives, like ready to eat food which just mix water and eat.
Right.
Sometimes it's okay, but all these food are many times associated with cancers also, which we may not realize right now, but after 15-22 years it may happen, right? There are various studies which have shown that food with preservatives may lead to such long-term disease. And obviously about the short-term consequences of food, we know that if we consume food after 4 to 6 hours of cooking, or we consume on next day or raw food, this may lead to gastroenteritis, which may present as vomiting, diarrhea, and may sometimes lead to critical illness leading to kidney disease also.
Okay. So now if we talk about men's health, we are celebrating International Men's Health Week. So in your experience and career, what are some of the trends that you noticed in men's gastrointestinal disease and issues?
See, basically, let us start with, if we are talking about men, then let us start with their lifestyle.
Right.
So even in Gujarat where we are staying, many men, they consume alcohol very regularly, as well as smoking, and tobacco is rampant in Gujarat, you know that. So all these habits are leading to indigestion. The reason is because tobacco, usually people tell that I spit it out, but it is not like that. You cannot spit 100% of tobacco outside. So something goes inside. Even your smoke, which most of the time people defend by saying that I just smoke it and I just throw it outside, but it is not the case. It goes in your lungs as well as it goes in your stomach also. So smoking and tobacco both are associated with loosening of the lower esophageal sphincter. Now this is a valve which is between the food pipe as well as in the stomach, and it prevents reflux of the food contents. So whatever you eat goes into the stomach, and then it should go beyond into the intestine. But if your valve is loose, then it will get reflux. So consumption of tobacco, alcohol as well as your smoking will lead to loosening of the valve, which will lead to reflux disease, which again has long-term consequences. As well as I told you that it's an hard-working era right now. Everybody is focused more on the career, on their targets. So eating habits are also not good. So out of 100 people, 100 men, if we see, 70 to 80 in India and in Gujarat will be above the body mass index. A normal body mass index is 18 to 24, which means you are not obese or overweight. So 80 or 70% will be above the body mass index, means they fall into the category of obesity or they fall into the category of overweight. So overweight is also associated with loosening of the valve. So if you have a fat kind of physique, it will lead to loosening of the valve and lead to reflux of the disease. So that is also important, that we should not get overweight also. So eating habits are related to this.
Okay.
And also I would like to mention that those who are eating more, above the calorie content, which is recommended by WHO, all these foods, ultimately majority what we are taking are carbohydrates and sugars and fat. So all sugars will get converted into fat, extra sugars. And this fat will get deposited in the liver or other organs, which again will lead to fatty liver. You might be aware of the fatty liver. So fatty liver, again over a period of time, it will lead to cirrhosis, which again is a life-threatening disease.
Right. So as you mentioned already, lifestyle plays a big role. In today's digital world, we are seeing that the upcoming jobs that are there, they are all sitting in the chair kind of jobs. And men also complain that the reason they are not able to take care of themselves is because they don't have the time to get up and exercise. So what can they do about it, and how does it affect them?
This is an excuse.
Right.
I would say that when the Prime Minister of India can do daily 1 hour yoga or exercise and walk, then why not all others?
Absolutely.
So this is just an excuse. Even we doctors have a lot of busy schedule, but still I also do exercise daily in an hour, for an hour daily, irrespective of whatever schedule I have. 7 to 8 is daily my exercise time. So it all depends on what you want. If your health, your personal safety of future is important to you, you will take out time. At present, your job, your goals, your targets, pleasing your boss is more important for you. That's why you are neglecting those things. But once you realize that it is important, you will take out time. So it is very important that at least half or 45 minutes we should take out time. And irrespective of what our schedules we have to exercise. The best thing is that don't depend on yourself to do exercise, because what happens, you sleep late in the night, in morning you are lazy, you are not willing to wake up. So best thing is either you join a gym, either join a sports academy, or have 2-3 friends who are motivated and they motivate you, or keep a personal trainer, but it has to be done.
Right. So more than a job, it has to become a part of our routine.
Yes.
Yes. So we see that things like gas, acidity or constipation have become common problems today. They shouldn't be, but they are, and now they are leading to even more serious gastro issues. So what do you have to say about that?
See, basically, it's very simple thing that we have to divide these things into acute and chronic.
Okay.
So now whenever you have an acute gas issue or acute pain, then it is not much of a concern. You may try with some medicines, with some home remedies, or you may meet your local doctor and take Gelusil to, for temporary relief. But whenever it is getting, increase for more than beyond 1 month or 2 months, then you should consult a specialist for this, and you should find out why exactly it is happening. As I told you that 60 to 70% of the patients have lifestyle issues. Once they improve their lifestyle issues, then definitely they will start, getting recovery from all these symptoms. So it is recommended that whatever you are eating, try to eat at least 5 to 10% less than what you deserve or what you desire. So that will also help, you know, to prevent all these symptoms. But if these symptoms are going for a long time, and especially there are some alarming symptoms like, you know, gas or bloating associated with weight loss, gas or bloating associated with blood in stools, gas or bloating, pain in the abdomen associated with decrease in hemoglobin, or any family history of any tumor in the past. So all these things are alarming symptoms. So if you have these issues and these issues are disturbing your sleep, your work, then it is a matter of concern.
Okay. So now talking about weather and food, they go hand in hand. So now it's summer, so everybody is enjoying mangoes. So we have seen that during the monsoon season especially, there's a widespread in cholera, jaundice, typhoid. So how can people consume safe and healthy food during that time and protect themselves from such diseases?
See, the best way is that irrespective of any season, we are seeing that even in RO water, which usually people install at their home, or in AquaGuard, people are getting infected by water as well as food.
Right.
So the best thing in today's date is also old school thought that you should boil your water the previous day, keep it in fridge, store it and use it for next day. I know it is very cumbersome to do that, but that is the most safest thing which one can do. And what was your other question?
How can people protect themselves how can they consume safe food basically?
Yeah. So this is one which I told you. Another thing is that whatever you cook, it should be consumed within 4 to 5 hours.
Okay.
Yeah, it should not. We should not be in a habit of consuming the same food late in the evening by re-cooking it or re-boiling it, or the next day. Many people do that. You know, we have traditional that vagarela bhat, you know, vagareli rotli. All that things should not be there ideally.
Right. Okay. So now if we talk about heart attacks, a lot of times it is linked with the acidity or chest pain, the burn that you feel inside. So are they actually related?
Yes. See, they are actually related. Usually the whole concept of heart attack is that the patients get an sudden onset of pain which is in the left part of the chest, and they get sweating, right? This is the usual pain symptom of heart attack. But many a times we have seen that patients may not come with chest pain, they will come with pain in the upper abdomen, or they may feel discomfort, gas, bloated, even back of the chest they will have pain. And this is especially in females. That females, middle-aged, those who have diabetes, they don't get pain. So they will get all acidity symptoms. Okay. So this may be in male as well as female, but more in females, especially who are middle-aged who have diabetes. So whenever patient come with acute gastritis or acute pain abdomen, we usually do an ECG also. And ECG, if it is showing any abnormal features, then we have to take care of that particular aspect of cardiac issue also. But my message to the community is that whenever you are having any kind of pain and abdominal pain, acute abdominal pain, discomfort, chest discomfort, and you have taken some gas medicine, if it is not responding within 1 or 2 hours, please get an ECG done, because it is very important. You may miss a peptic ulcer or gastric ulcer, that's not a problem. But if you miss a cardiac attack, then it will be life-threatening.
Now, recently there has been a lot of rise in taking care of our mental health. So, I want to know from you, doctor, is there a relationship between our gastro issues and our mental health?
See, there is a scientific concept called gut-brain axis.
Okay.
Even if you search on Google gut-brain axis, you will get good detail about it, that all your nervous system is connected to your intestinal system. The best example of this is if we talk to our 10th standard or 12th standard students who are, doing board. Whenever they are very anxious about the studies, or they are working hard, sleeping less, not eating food of time, then many of them complain of abdominal pain. Sometimes they complain of loose motion, sometimes they complain of diarrhea. And once exam is over, everybody is fine, So this is the example of gut-brain axis, that whenever you are tensed, you may get either constipation, you may get either abdominal pain, or you may get even diarrhea.
Right.
So it is very important that those patients who are suffering for long term from acidity or constipation, they should definitely get themselves evaluated thoroughly. But then if you are not getting anything, in our practice we have seen that once we do all kind of tests, we don't get anything, the patients get frustrated, they are not ready to believe that why I'm not able to, know what problem I have.
True.
But that is mental health.
Yes.
And every time it is not like that, that you may realize that you are in stress. Sometimes you are, waking up in morning, going with friends, doing your work, but still you are stressed out.
Yes.
So it is important to understand that the best way is that, as I told you earlier, that don't exercise, that's okay, but at least walk for half an hour, 45 minutes alone in a garden or with friends. Don't think about your, what you are going to do in the rest of the day, what your work is spending, what you are going to talk to your colleagues or boss, or don't think anything and just concentrate or walk. Or at least meditate for half hour, 45 minutes, which will cool your nerves and it will help you.
So next time if you are having any gastro issues, it may be related to something that's stressing out you in your
and
life.
one more thing, if suppose these symptoms, as I told earlier, are associated with weight loss, appetite loss, and your severe pain or loss of blood, then again it may not be related to mental issues.
Okay.
So whenever you are contributing your issues to mental issues, it has every other things have to be ruled out scientifically.
Right.
We should not miss any particular cause which may lead to further deterioration in health, considering that this is a mental health.
Right. So, talking about senior citizens of our society, a lot of men in their older age also face such gastro issues. So, how can they take care of themselves better?
See, basically in old age, as one gets spectacles,
Yes.
all organs are going to have some or the other issue.
Right.
So usually old age people, they have bloating because their stomach doesn't contract as it should, so to propel the food. They have constipation, again the same reason. So in that case, what we have to do is that we have to keep our organs mobile, and how do we do that? By walking and exercise.
Yes.
We should also ask them to consume lots of amount of water, provided they are allowed to, because many of these patients will have cardiac disease also.
Okay.
So they should take more of water, more of fibers, which means fruits and vegetables. And one important thing, that those who have constipation, they should use an Indian toilet. The reason is because the Indian position gives an angle for passage of stool very easily. So now all of us have Western toilet, but the best thing is that what we can do is, whenever we are sitting on the Western toilet, we can keep one stool at the floor and then keep our foot on that, which will give an angle of Indian toilet.
Okay.
So now Indian toilets are not there, but we should encourage that. Now even Western community in US also, they are making Indian American toilets, they are combining it, because scientifically it has been proven that if you sit in an Indian position, you will be less constipated.
Right. So, with that, we come to the end of our enlightening conversation. And Dr. Harwani, thank you so much for sharing your expertise with us. And this has given us a lot to reconsider in our daily lives to take care of our gastro issues and lead a healthier lifestyle. So, remember to prioritize food safety and maintain good health practices. Stay healthy and take care. Thank you.